across the globe. Prostate cancer screening. You see, early detection can really be a game changer, significantly increasing the chances of successful treatment and recovery. Yet, despite its importance, many men are hesitant to undergo screening due to various misconception fears. That's where my next guest comes into play, making reference to Dr. Suelyn Hall Harper. She is a urologist and founder of Quantum Health and Wellness Center. Oh, by the way, she happens to be the author of How to Get Ahead. Dr. Suelyn Hall Harper now joins us right here on the Live Zone. Doctor, it's good to see you. Thank you so much for joining us.
Thanks for having me.
But of course, prostate cancer screening rates, quite honestly, ma'am, are still lagging. That is a big issue. And so the question I pose to you is, why do you think so many men are avoiding a test that could really save their life?
So many men are worried about a digital rectal exam. However, things have changed, and we as physicians need to educate men to not be fearful because early detection has such a different outcome, and the results can be so much better if we educate people more about the need for a PSA exam. But now there's MRIs available that can actually do a more intensive evaluation and detection and not necessarily need to do even just a rectal exam.
Yeah. I recently had my prostate cancer screening done. I guess it was a year ago, and I'm saying that live on TV, and I'm hoping you're not looking at me saying, Guy, you need to do it again sooner. But you know, you hear the stories, and that was my first time. Guys, it wasn't that bad. You know, I got through it, and yet again, it was all about making sure that I'm healthy, and I put that paramount to a little bit of discomfort, if you will, while undergoing that actual process. If a man's father had prostate cancer or his mother had breast cancer, what should that mean for his own screening?
So initially, we used to check men at age 50. However, African American men have an earlier disease process, so they should be checked at age 40, actually. And if you have a family history of prostate cancer, you should also be evaluated early as 40 years old. And that's just with a blood test, a PSA, which it stands for prostate-specific antigen. And it's just a simple blood test. If it's elevated, if it's higher than 2.5 at first detection, then we check it more frequently. Men at age 40, the PSA should be less than 2.5.
Yeah. Once someone is, let's say, diagnosed, there are several paths perhaps one can actually go down and or utilize, if you will, in order to make sure they see that light at the end of the tunnel. Do tell.
Yes, so there are many different issues when somebody has an elevated PSA. First, we can actually evaluate with an MRI, which can tell us if there's a PIREDS 1, 2, 3, 4, or 5. What is our suspicion? What is our treatment plan? What do we do? So this is a shared decision making. If men have a family history of prostate cancer, have an elevated PSA, and have an abnormal MRI, they should proceed with a biopsy. And the biopsy is a simple procedure done out in the office. As you saw in the video, just a biopsy, an ultrasound, and a detection with a gun to just basically take a small piece that's sent to the lab. However, if this is positive, many treatment options. There's watchful waiting, which is a new, more conservative management, especially if the PSA or the grade of the tumor is small. And there's also surgery to excise the tumor. Now we have robotic surgery, which is very easy, more outpatient-based in regards to not long hospital stays. And then there's radiation therapy, whichever is best for the patient and the physician, depending on the grade, stage, and extent of the tumor, is usually what the decision making is made.
Yet again, I want to revert back to the conversation, and that's the conversation to really encourage more men to get this done. Perhaps you could provide us with some encouraging words. How would one begin that conversation? And I'm thinking about perhaps my brother. I want to pick up the phone. What should I say? How do I initiate all of this?
You can tell him, one, that you've also had an evaluation done, and as an African American male, he really wants to be checked early, because if we find the disease early, we're so good at treating it, there's nothing to worry about. However, if found late, very high risk for even death. And that's a major statement. There's so many young men that weren't checked early that could have been treated and been alive And so it's an important thing to discuss with family, especially if someone's had a mother with breast cancer. There's now detection that men may get prostate cancer, but if found early, so important. And just a blood test and an exam really is not that difficult.
Wise words yet again from Dr. Suelyn Hall Harper. She is a urologist and kind enough to join us right here on the Fox 5 Live Zone. I truly appreciate your expertise.
Thanks for having me.